But I prefer to say, because I'm very critical with my country, because it's also my work, that we have a quasi-universal healthcare system. We have some spots of population that are not covered by our healthcare system, mainly migrants that come to Spain and are not in a regular situation in terms of bureaucracy. So what we are trying to do now, we are going to create a new universal care law where people that have no right to go to the system because they don't have the legal papers for doing that, just they sign a document and then they can have an identification card. That will be very great because it will eliminate part of the bureaucracy barriers that we have. Sometimes what happens with people that are in a very vulnerable situation is that they find the healthcare system not only as it is difficult for me to go, but also as part of something that scares them because, well, the healthcare system is part of the legal system also of a country. So we need two lines of conversation there. First, we need some tables in the hospital to integrate that all the care that they give in them. Internal medicine sometimes do that, but it depends on the hospital, so it's not only just one specialty for that, but maybe places to discuss complex patients. And then also they need to have the conversation with the primary healthcare physician because they're family physicians. They know all their life. So that's a really important thing. And sometimes when we do that, these conversations is just in the clinical record, like, hey, that happens. And no, we might have places to discuss that, and we are not very successful in that. There are some experiences in Spain, in some regions, with successful stories about getting closer primary healthcare and hospital care in that, but that's not something that is like implemented in all the country.